how do we stop squashing the nerve in our elbow? So the short answer is you just stop squashing it. So you don't bend your elbow more than 90 degrees for sustained periods, and don't lean on your elbow, and don't put any pressure on there. And then that would hopefully ease the pressure off the ulnar nerve, which would then take away the pain and the symptoms. That's a lot easier said than done, particularly if you are like me and when you sleep like this. So sleeping is one of the biggest times that we need to stop squashing the nerve to allow it to heal during the night rather than be constantly aggravated. So one tip is, if you are aware enough of how you're positioned when you're sleeping, which most of us aren't because we're asleep, you can go to sleep and try and sleep with your arms out straight. Now, the way that I find the easiest for people is if you actually sleep on your side and you put a pillow here. So you put one arm underneath the pillow and one arm, and then the pillow, and then the other arm on top. What I find is that gives a little bit of resistance so that you can't pull your hands in like this because the pillow's stopping. It's a little bit tricky though, because number one, it takes up a lot of room in the bed, and number two, you don't know what you do in your sleep. So we use things such as this nice little elbow brace at night time. Now, it's really soft. It's basically like wearing a cushion on your elbow. It's got Velcro and it's nice and soft, but it does have this firm piece of plastic in there, which actually helps to limit how you bend your arm. It also is nice and cushioned so that you can't lean on your arm and cause extra pressure. So you just pull it up like a sock around your elbow, and then what you do is you just wrap them around like so, and you need it to be firm so that it doesn't fall down in your sleep, and then you just make sure that it's in the right spot. And then you can bend a little bit in it so that your arm doesn't feels funny from being held directly stiff all night, but it's very hard to bend all the way up, okay? Sometimes people feel like they can bend too much, and that tends to be because they've got this hard bit in the wrong spot. So you just pull it down, wriggle it around until it's in this spot, and now I cannot bend it more than 90 degrees. So that can be a really nice option, because then you can go to sleep. It's nice and comfortable, and you just go to sleep. So during the day, after you've had an actual rest overnight by wearing the brace, then during the day, you can be constantly thinking, don't lean on my elbow. Don't bump into things with my elbow. If you're talking on the phone, you want to be using a hands-free device so that you're not holding the phone to your ear for long periods of time. So using your headphones rather than using holding the actual handset. All of those things can actually help to stop squashing the nerve, which will then ease off the pain in this half of your hand and the pins and needles.